Well, good morning. Thank you all for being here today. I'm Joseph Manning, and today I'll be presenting on the Appalachian Community Health Emergency Act. Before I begin, I'd like to thank my entire team, especially my task team, for their help on this briefing, and I'd like to give a special thank you to Professor Callahan for all of her guidance throughout the entire semester. Today's agenda, we will start with a background of what mountaintop removal coal mining is. Then we'll get into the purpose of the bill itself. We'll discuss some of the controversies that are surrounding the bill. We'll examine the science behind a health risk assessment. And then we'll discuss what are the measurements of success for this bill. So, what is mountaintop removal coal mining? It's an extractive surface mining process common in the Appalachian Mountains. Quite literally, it is as the figure on the right demonstrates, it is a process whereby the tops of mountains are blown off with explosives. All of the rock, all of the soil, all of the vegetation is blasted away and then dumped into the surrounding valleys as valley fill. This is a process that has been controversial since its inception because of the potential damages that it causes to ecosystems and watersheds. But in recent years, it's attracting even more controversy because of the potential human health impacts. For example, valley fills often contain high levels of toxic metals that could damage human health, and the blasting process releases particulate matter into the air, which can also have negative health impacts. There's a correlation that's visible between mountaintop removal mining and negative health impacts. One example of this can be seen from data presented here by the CDC on cancer mortality rates in Appalachia. The red dots are mountaintop removal coal mines, and the dark blue areas represent mortality rates above the national average of 165 deaths per 1,000 individuals. Some of those rates and the darkest blue shades are twice that number, at more than 220 deaths per 100,000 individuals. What we can see here is a correlation, and similar correlations exist among birth defects, respiratory disease, and cardiovascular disease. And it's concerns like these that prompted Congressman John Yarmouth to introduce this act in 2013. So, what is the purpose of this bill? It is designed to place a moratorium on mountaintop removal coal mining until comprehensive health studies are conducted and published. There are 4 parts. The first is a health risk assessment, which is a process by which a scientific community will analyze what are the potential risks posed to communities and how they associate with mountaintop removal mining. And from there, the Secretary of the Department of Health and Human Services will issue a finding on whether or not mountaintop removal coal mining negatively impacts the health of the communities in Appalachia. The second part is a mining permit moratorium. This is a moratorium on all new coal mines in all new mountaintop removal coal mines in Appalachia. It allows existing mines to continue to operate. In order to make sure that these mines are operating safely and to measure the levels of pollutants from this mine is the third part of the bill, which is continuous impact monitoring. If you're operating a mine in Appalachia right now, you will have to start reporting the pollutants that you put into the environment. And if you fail to do so, your permit can and will be revoked. And the fourth part of the bill is a means of financial support. Health impact studies and continuous monitoring are not cheap. So this allows the president to levy a one-time fee against all operators of mountaintop removal coal mines so that they can cover the costs of those 2 parts of the bill. This bill is going to face strong resistance in Congress. It has many opponents who are concerned about a variety of issues, the first of which is the potential impacts on the economy of Appalachia. Mining jobs are often brought up as a central part of the Appalachian economy, and there's concern that moratoriums will eliminate some of those jobs. Additionally, coal companies themselves like mountaintop removal coal mining because it's an incredibly cost-effective way to extract coal. And finally, consumer groups are often also concerned about the potential negative impacts on electricity prices, because consumers right now in the United States benefit from cheap coal-fired power. However, we should be skeptical and at least ask questions about some of these impacts. Data from the Kentucky Department of Energy Development and Independence shows that coal mining jobs in eastern Kentucky, which is the heart of Appalachian coal mining community, have been on a steady decline over the last 30 years and now don't make up the proportion of the economy that they're historically believed to make up. The science is also not settled on this issue. Here I have two quotes, one from John Borak at Yale and the other from Dr. Margaret Palmer at the University of Maryland. And they represent opposite ends of the spectrum about what are the potential damages of mountaintop removal coal mining. Dr. Borak says coal mining is not per se an independent risk factor for increased mortality in Appalachia, while Dr. Margaret Palmer concludes that scientific evidence of the severe environmental and human impacts from mountaintop removal mining is strong and irrefutable. This is why the bill is important that we conduct a comprehensive health study in order to try to reach a scientific consensus on this issue. Of course, it is important to note that Dr. John Borak and his colleagues their research has been funded through grants from the National Mining Association. So, what is the science behind a health risk assessment? There are 4 parts of a health risk assessment. The first is hazard identification. This is a process by which we identify the toxins that are contaminating air, water, and soil in the surrounding communities. The second is exposure assessment, which involves the detailed and comprehensive sampling of air, water, and soil in these communities to determine the exact concentration that communities are exposed to. From there, we move on to a toxicological assessment, which says these are the concentrations that exist. How are these toxins at a level which they're damaging to human health? And the final part is the risk characterization, which takes all of the above data and summarizes it and draws the conclusion about whether or not communities are at risk from this process. So, this bill hinges on a successful community health impact study. So the way we know whether or not it will be a success is if a determination can be made by the Secretary of Health and Human Services as to whether a causation exists between mountaintop removal mining and health issues in Appalachia. It does not matter if that causation is positive or negative, but the Secretary of Health and Human Services has to be able to make that determination. This will not be an easy process. It requires us to consider some major questions like, what is the scope of the study required in order to make such a determination? Which includes how many communities should be studied and how far should these communities be from mining sites? We need to establish a solid baseline data, which requires us to consider what are the naturally occurring levels of toxins in the soil and air and water in these communities. And are there comparable communities in socioeconomic terms? And if so, what are the cancer rates, the birth defect rates, the rates of respiratory and pulmonary disease in those communities? Finally, if this determination is going to be accepted by the communities, by industry, and by the scientific community, it needs to undergo rigorous peer review and public comments that are then incorporated back into the final findings of this study. So in conclusion, there is a correlation that exists between mountaintop removal mining and human health impacts. But political and scientific controversies are preventing action so far. This bill attempts to get over those controversies through a rigorous health study, but it will only be successful if a causation can be proven. So, thank you so much for your time, and I will take any and all questions.
Hey, Joseph.
Hey.
Yeah. I was wondering, where are the coal power plants placed? Are they within the community? And if so, are they maybe causing the health impacts?
Yeah, that's a good question. And I mean, there are definitely coal fire power plants in some of these communities. Not all of them, though we didn't look into specifically where power plants are placed. We focused on the mining operation itself because that's what the bill covered. But that's definitely a factor that a health impact study will have to take into effect. What are the other potential contaminants? What are the other sources of pollution that could be impacting these communities?
Hello, Joseph. Good job. You mentioned studies from researchers at 2 other universities, and I was wondering if by any chance you know if similar research has been done here at Columbia and what those studies say?
Actually, that's a good question. I don't know if there are researchers at Columbia that are doing research on this.
We do research on everything here.
There you go. Spoken from the expert.
Actually, in the School of Public Health, Pat Kinney in particular has been working for a long time on the impact of toxins from air on health. And there's in the environmental science and health department, Joe Graziano and others that work on these areas also. So I don't know about the specific issues here, but we have a lot of people working in this area.
Great.
Thanks, Joe. That was a great presentation. My question is about the fees, the one-time fees for the mountain. For this, I was wondering if the fees for the health impact studies were proportionate to the size of the mountaintop removal project, or is it sort of like a one-size-fits-all fee?
That's a great question. And the bill sets no parameters on the fee. Literally, the exact wording is that the president will levy a one-time fee against all operators of mountaintop removal coal mines. That's all it says about it. So any discussion of management and implementation of this bill will have to consider that in great detail.